Andrea Mitchell is our veteran chief foreign affairs correspondent. Of course, the host each day of Andrea Mitchell Reports on MSNBC. Andrea, none of this is about us, but I'm remembering taking over for you as White House correspondent in, 1995? Between us, we've seen a few things. Never anything like this. Talk about where this leaves this president, our country, and the presidential race with the whole world watching.
It's a devastating outcome for the president personally, so that is the first thing we have to think about, because no matter how asymptomatic he may be right now, and the First Lady, of course, we have to, as Dr. Gupta just pointed out, worry about his age, his other comorbidity factors. We've not had a real medical report from this president, unlike previous presidents. This is the first president we have not had a full medical report, a really transparent disclosure, and we have not had a full medical report even when he was candidate Donald Trump. Remember all the controversies over that and the controversies over his first physician, Ronnie Jackson. So those are concerns. We really don't know what the baseline here is. And there is the foreign policy and domestic policy and the election campaign. I mean, it's a confluence of things. So we note that Boris Johnson and other leaders other heads of state have had the COVID and have survived wonderfully from it. But there is also the long-term effects, and that's another thing that is not well understood even by the scientists who are studying this disease. Match that, of course, with the president's own past history on COVID, calling it a hoax, denying it, downplaying it, the Bob Woodward reporting, all of the reporting, the conflicts with Dr. Fauci, with Dr. Redfield, the other members of the White House task force, downplaying them, listening to Scott Atlas, the radiologist who is not a public health or a virologist expert and who has been largely discredited and criticized from within the task force, among the others, from all of our reporting, the disclosures, the whistleblowing report from Olivia Troy that broke first on the Washington Post and then on NBC and MSNBC, all of this information showing how much he has discredited and disputed and pressured the doctors, the experts around him, and undermined the FDA, the CDC, and the others who have tried to help the American people with their warnings, as recently as today with Hallie Jackson, Admiral Giroir, saying, wear a mask. Wash your hands, avoid, make sure you social distancing, avoid indoor locations. With the governor of Wisconsin just today again, and other officials there arguing that he should not come to two events that were scheduled for Saturday, with Wisconsin one of the worst hotspots right now in the country. So all of this, the trajectory of, all the people who have now died, more than 200,000 people who have died, 7 million plus who have had this disease here alone in the United States. And a lot of this, of course, attributed to the handling of this by the White House and the president's skepticism early on and his continuing arguments with the public health experts. That is all wrapped up in an election campaign. As you know better than anyone, Brian, we're 33 days away from the election, 32 days, I guess. We're past midnight now. And this is about as big a domestic and international crisis as I can remember. And you refer back, I remember standing, at Bethesda Naval when the head of the National Cancer Institute announced that President Reagan had cancer, colon cancer at the time, and it was a national crisis. I remember covering the assassination attempt against President Reagan. Any time a president of the United States is ill, obviously the 1981 assassination attempt was the worst that I've ever covered. That's a crisis for the country. We all pull together. We all hope for the very best. It becomes, especially in this day and age, and with this president, given all of his skepticism about COVID-19, Brian, and the way he's handled it, and the Tulsa rally, he again was disputing just the other day. Last night, Wednesday night, he was in Minnesota with no social distancing. At the debate on Tuesday night, There was, according to Monica Alba of our team, who was there as one of the pool reporters, there was an incident where someone from the Cleveland Clinic in a white lab coat approached the White House team, who had taken off their masks and while they were being seated, and tried to approach at least somebody in the party to get them to wear masks, and then backed off. So did not have an interaction with anybody, with the First Family and anyone in that group. But the president and the entire First Family were there, and we all saw them without masks. Certainly the president on the stage was not supposed to be wearing a mask. He and Joe Biden were not, and nor Chris Wallace, the moderator. But the people in the audience had been encouraged to wear masks even while they were seated. And there was no social distancing among the people in the president's party in that front row. So there were so many questions being asked about all the people in Minnesota who were at that rally. Obviously, it's an outdoor rally, but there were people, there were greeters at the airport, there was a lot of handshaking. And we've seen a lot of handshaking in the White House recently, at White House events, at all kinds of events with people, including the vice president and his team, all shaking hands, members of the cabinet. So very little effort to observe or even model the behavior that the public health officials have been advising. Brian?
Andrea Mitchell, covering the scope of this, answering all our questions. Thank you for your coverage and your calm at this hour.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.